Hi, my name is Nancy Herr, and this is my nursing theories and personal philosophy. The theorist I chose is Hildegard Peplau. She graduated from Pennsylvania School of Nursing in 1931. She also served in the Army Nurse Corps and was assigned to the 312th Field Station Hospital from 1943 till 1945. In 1952, Hildegard Peplau published her theory of interpersonal relations. Hildegard Peplau interpersonal relations theory. There's four major concepts to her theory. The first one is man, in which she says is an organism that strives in its own way to reduce tension generated by needs. The client is an individual with a heartfelt need. Health, a word symbol that implies forward movement of personality and other ongoing human processes in the direction of creative, constructive, productive, personal, and community living. Society and environment encourage the nurse to consider the patient's culture and more when the patient adjusts to the hospital's routine. Lastly is nursing, significant therapeutic interpersonal process. She defines it as a human relationship between an individual who is sick or in need of health services and a nurse specially educated to recognize and to respond to the need for help. How do I practice this theory at my job is I assess my patient through asking questions about the reason for their visit. I create a plan of care for my patient. I always consider patients' social and cultural beliefs while my patient is in my care. I always create a human connection with each of my patients by assessing and reassessing patients' need frequently throughout my care. Hildegard Peplau interpersonal relation theory also has four sequential phases. The first one is orientation, which involves engaging the client in the treatment, providing explanation and information, and answering questions. Part two is identification, which begins when the client works interdependently with the nurse, expressing feelings and beginning to feel stronger. The third one is exploitation. The client makes full use of the service offered. And the fourth one is resolution. The client no longer needs professional services and gives up dependent behavior. The relationship ends there. 7 nursing roles are also part of the interpersonal relationship theory. The first one is stranger, offering the client the same acceptance and courtesy that a nurse would respond to any stranger. Number 2 is resource, providing specific answers to questions with a larger context. And the third one is teaching, helping the client to learn formally or informally. Fourth one is counseling, promoting experiences leading to health for the client, such as expression of feelings. The fifth one is surrogate, serving as a substitute for another, such as a parent or a sibling. The sixth one is active leadership, offering direction to the client or group. And the last one is seventh one is technical expert, providing physical care for the client and operates equipment. So with her theory, the way she relates it to the person is a developing organism that tries to reduce anxiety caused by need. The environment consists of forces outside of the person and puts in the context of like culture. As far as health, a word that symbols that implies a forward movement of personality. And the last one is nursing, is a significant therapeutic interpersonal process that functions cooperatively with another human process that makes health possible for individuals in communities. Personal philosophy of nursing is I believe nursing is a practice that serves others through promoting health and wellness. I practice nursing because I believe that if we take care of each other, we can prevent disease and live healthy lives. I practice nursing because I want to make a difference in people's lives. It's truly rewarding to be a service of others during tough times. My belief about patient care or a patient is that the care that they receive can be treated with respect and dignity. I must recognize that each one of my patients is unique in physical, emotional, social, and spiritual ways. My belief about health is that health is the most important thing in anyone's life. I believe that living a long and healthy life begins with disease prevention and wellness. My belief about the environment plays a crucial part to my patient's wellness. The environment in which the patient is receiving care can hinder or promote health. My application of personal philosophy in nursing is I strive to inquire about my patient's needs, preferences, and value through asking questions in order to provide individualized care to improve my patient's general well-being. I ask that my patient is involved in making their own health decisions and encourage them to involve friends and family for support. I always educate my patient about preventing disease through diet, exercise. I also educate my patient on having healthy relationships with the people they care about to promote social health and physical wellness. I believe that my patient should be in a clean environment with comfortable room temperature and minimal noise. I believe in the evidence-based practice on sanitation and standard precaution to promote health and prevent the spread of infections. I always sanitize hands and any equipment I use on my patient, along with donning and doffing properly when entering and exiting a room with precaution. And so here are my references. Thank you.